The world that we envision is that people come into the healthcare delivery system. They don't have to navigate for themselves. They have care that's coordinated. They have services that are offered to them that is all seamless, and they can move in and out of the system, whether it be physical health, mental health, substance use disorder, whatever it might be, without having to figure all that out for themselves.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Debbie Witchey, President and CEO of the Association for Behavioral Health and Wellness, or ABHW. Debbie, welcome to the show.
Thanks, Joanna. I'm thrilled to be here.
So tell us about ABHW.
ABHW was formed about 30 years ago. I'm only the third CEO that they've had, and our members are health plans in both the public and private sector who provide behavioral health and substance use disorder health benefits.
Does every health plan provide these benefits, or not all of them?
Not all of them do, and all of them provide them very differently. So our members are the leading providers of these benefits in the country. We represent about 200 million lives.
So Debbie, why is it, I'm going to ask as a consumer here, why do some health plans provide these mental health benefits and some don't, or behavioral health benefits?
I think it's just a business decision about what services they want to offer. As I mentioned, some are in the public space, so they're providing these benefits through Medicaid. Some are primarily in the commercial space, so working with employers to provide these benefits, and then some are a mix.
Well, we clearly have a lot to talk about because this is a big space with a lot going on. But before we do that, Debbie, let's talk about your journey. You've got this really interesting background, and then you became an association executive. So tell us the story.
I have a very eclectic background. Right out of college, I came to DC looking for a health policy job. Couldn't find one, needed to eat, and ended up signing on to presidential campaign for then Vice President George Herbert Walker Bush.
Wow.
And I helped there with setting up steering committees and opening and closing some state offices when we got to the campaign world. And from there, I thought, okay, now I'm going to go into health policy for certain. And instead, they asked me to head over to the Treasury Department. And I remember I was in my 20s and I thought my world was over and I was never going to do health policy. But I went to the Treasury Department. It was a fabulous experience. I learned all kinds of things about how federal government works, just generally, that have served me well to this day. I ended up staying for one more year. The Clinton administration asked me to stay and help them with their transition. So I did that for 1 year. And then I decided, okay, now I want to do something in the healthcare space. So I took my management experience that I had had at Treasury and got my master's in health administration. So I thought I'll combine these two things together. So at that point, my husband had taken a position in Charleston, South Carolina. And so I went to grad school there. And then I was offered a really fabulous position setting up, we called it Community Health Initiative. So it was taking the hospital system outside the walls of the hospital. And this was back before people were talking about social determinants of health and delivering healthcare outside the walls. So we set up wellness programs with employers. We had nurses in churches. We had nurse practitioners in at-risk schools. So trying to get on the front end of healthcare delivery before folks ended up in the ER with really serious issues that required very expensive and difficult care. I came back to the Washington area 8 years later, went to work for an organization called Healthcare Leadership Council. They initially hired me to help with their regional work and their grassroots programs because of my state and local experience. HLC is made up of CEOs and C-suite executives from all sectors of healthcare. So everything from health plans to pharma to medical device, you name it, they cover the spectrum. And then I moved on to become chief advocacy officer and COO there and left last year and decided that I really was looking for sort of an opportunity to lead, but also to work in more depth on an issue that was a particular interest to me. And around that time, my predecessor, Pamela Greenberg, announced her retirement. And I felt like, okay, this is going to be the right place for me. And luckily, after the interview process, they decided the same. So I've been at ABHW. I just started my 5th month. So I'm a newbie.
Wow, congratulations. Okay, I got a zillion questions about this journey. You came to Washington, D.C., hell-bent on getting a job in health policy. Why health policy? That's a very specific thing, and you're in your 20s at this point.
Well, I think partially, probably I have my father to blame or credit for that. He worked in health policy for much of his career, and he ran the state Medicaid program in Pennsylvania for a while. So I think that's why I had exposure to some of those issues. I was interested in healthcare, but knew I didn't want to be a clinician. So it seemed like an area where I could have an impact. And I went to Duke undergrad, and a professor who I got to know there really encouraged me and helped me to understand more about what was going on in managed care at the time. You know, this was back when managed care was really just getting its start. But she kept saying to me, this is the wave, this is the wave. So I did an independent study with her, and I guess the rest is history, so to speak.
Wow. And so now you are in a position where you are influencing health policy. Amazing.
Yeah, it took me a circuitous route, but I finally got here, and I really do. I love that. Sometimes it's a blessing and a curse, I guess. But I mean, we're all touched by healthcare delivery. We all have our own stories, and really understanding and being able, I mean, on a personal level, I'm constantly helping folks navigate the system. I also understand so well what quote unquote good healthcare looks like and what bad healthcare looks like. I know it's challenging, but I like being part of trying to get to a place where all of us can have good healthcare delivery without having to have an expert in the family or in the friend group.
Debbie, you're a new CEO. You've had many leadership positions, but it is different being CEO of a healthcare association. What was that transition like? What is it like?
I'm still in the middle of it, to be honest, Joanna.
Yeah.
I mean, part of it were things I didn't frankly anticipate because we're a relatively small organization. There are a lot of administrative responsibilities I hadn't really thought about. So becoming the trustee of the 401k, for example, was a process in and of itself.
Right.
That I hadn't planned on the hours that would take. And also making sure that I am a good steward of those funds for the employees, and taking on that responsibility is certainly something new that I hadn't done before. So that's something I didn't really anticipate. I have always, through my whole career, I think you probably heard bits and pieces of it, believed that we need to bring together many groups, disparate groups that don't always seem to agree on the surface on issues. And so that's something that I knew I wanted to do more of at ABHW. And so I've been on what I unofficially call a listening tour for the last few months, talking to our members, talking to some of the corporate partners who are part of our membership. Those are folks who deliver services for health plans in the mental health and substance use disorder space, but also talking to other groups and strange bedfellows, I hope one day that we'll be working with, who maybe we haven't always perhaps agreed with on the issues, but really trying to understand what are people's and organizations' views on ABHW, and where can we make a difference, and where can we work with others to really drive integrated and coordinated care forward in mental health and substance use disorder.
Now, Debbie, I hear from a lot of new CEOs that they go on these listening tours, and they do it as a way to immerse themselves in the issues and to meet the members. What themes are coming out that's maybe expected or even surprising?
I think a couple of themes. One is I think that everyone agrees that we need to have more data and more information about what behavioral health programs, not just benefits, but programs work and which ones don't. We need this across all of healthcare. But what I have seen and what I am learning is that we are a little bit behind in some areas of behavioral health and really understanding what kind of programs are going to produce good outcomes and which kinds aren't. And so then as you start to unravel that, why don't we have that information? Part of that reason is because we don't have good data sharing. Some of it's wonky because behavioral health providers were excluded from the HITECH Act when money was given for setting up electronic health records and integrating. Some of it is because a lot of providers in the field are solo practitioners, and so they have their own systems to track information that don't roll together. There are lots of different reasons, but that's something that unites all of us, that we can have better care delivery if we can all come together. And I've heard that from provider groups I've talked to, as well as our members. I also think while ABHW helped to author the legislation, the mental health parity law that was enacted 16 years ago and helped to get it passed, I think over time there's been this impression from some consumer organizations that health plans don't want to implement the legislation. So I've been spending some time helping them to understand where ABHW members stand on that. And they do want to see that legislation implemented. I think they've had some frustration with how, and this isn't a political statement, it's really been multiple administrations have tried to implement the law, and there have just been a lot of challenges around that. So trying to help groups to understand what those challenges are and to get their help in trying to make that work better. At the end of the day, the other theme that I've heard, and this is something we worked on a lot when I was at HLC, is that we need better coordinated care overall. My first week at ABHW, I learned that the majority, vast majority, like 80-something% of people who enter the healthcare system needing behavioral health services come in through a primary care doctor or a pediatrician. And our system really isn't set up for those providers to know when they need to triage them to a psychiatrist, or when they need help from a licensed clinical social worker, or when they can stay with that provider to get services. So we just need to do a better job overall to coordinate care and making sure that those handoffs happen when they need to, and that they happen without gaps in care. And that's the other theme that I've heard across the board, is that we need to figure that out.
Wow. Well, let's step back a little bit and turn to ABHW and all the things that you're doing. How is behavioral health defined? Let's make sure that me and my listeners are on the same page. When you say that your members are health plans that have behavioral health benefits, how is that defined?
This is something else I learned. Behavioral health or mental health services. So that could be depression, anxiety, bipolar, autism is usually categorized in the mental health category. So mental health, and then substance use disorder. So behavioral health as a whole are both of those categories of benefits.
And so your members are the health plans that have those benefits, and they join ABHW for what reason?
They join ABHW because we are the only organization that is focused on behavioral health benefits specifically and how that care is delivered. You have other health plan associations that touch on these issues, that work on these issues, but it's not their number one priority that they work on all the time. And I've spent time talking to AHIP and Blue Cross Blue Shield Association and community health plans and many other of the plan organizations. But as I said, I think we're uniquely positioned to focus on behavioral health and how best to deliver those benefits. And at the end of the day, we're going to have to work with the other groups because, as I said, we want behavioral health benefits eventually to be integrated into medical benefits so that there is no differentiation between the two.
Well, Debbie, you say that your members want to be at the forefront of delivering behavioral health and really measuring the outcomes. So how is the association helping them to do that?
A lot of our members have their own initiatives that they are doing on a pilot basis in this area. But I think one of the things they've learned is that, and I think this is important, and I'm glad that they know this, is that it's difficult for providers to be working with numerous different health plans and responding to a pilot program with one and then a slightly different pilot program asking for data from another. And so to the extent that we can make that uniform and make the providing of data and information seamless for them, the better off it's going to be for all of us. We can't be burdening the provider with trying to do all of that reporting. So ABHW can bring the plans together to try to determine what information would be most helpful. And then, as I said, by working with other groups, provider groups and other stakeholder groups, thinking about how to make that work better as well.
Debbie, are you collecting data yourselves, or is that being done by the members?
We don't collect any data at ABHW. And frankly, at the end of the day, any kind of data that's collected, we need to make sure that it's de-identifiable and that it's protected.
Right.
And there are certainly some trust issues about collecting that. And that's why I think it's so important to work outside of our membership as well, so that organizations are comfortable with what we're recommending.
Debbie, a big part of what you do at the association is advocacy. So what specific issues are you advocating on, and how's it going?
So we go through, it's really an impressive process that I can take no credit for because it started before I got there and we're continuing it, but a process of interviewing our members about what they think are the most important issues for the year from a regulatory and legislative perspective, and then doing an assessment of the landscape to see what is most likely to be on the agenda from Congress and the administration, and then meshing those together. And so we have 3 tiers of issues. So there's the top tier, which is either something that we think is critically important or something that we think Congress or the administration is going to want to address. So we need to be prepared to provide information and help on that. So some of the issues that are on our top tier list are certainly telehealth, workforce kinds of issues, all of those pieces that need to be addressed to make sure that we're delivering better care. I mentioned the mental health parity rule. That's something that we want to make sure is being implemented in a way that works for patients, providers, and plans. So that's certainly something with the new administration we'll be focused on. And then there's several other issues, but we're also trying to work in a more general way to educate new members of Congress and new staff on the Hill about behavioral health issues generally, so that they, one, see us as a resource, two, they do have a level of knowledge on the issues, and hopefully that will help them to make good decisions as they're looking at potential legislation.
Yeah, I think you're calling it your Behavioral Health 101, right?
We are. So we're putting together we're trying to make it easily digestible. So it's a little bit more than a chart pack, but something that will be a resource and reference point. And we're going to be starting to share that with folks on the Hill in the next couple of weeks. But again, as I said, it won't necessarily be about specific issues that we are working on or that we're advocating for, although those will be in there, but it'll be a general education on behavioral health policy so that we can help them to get up to speed.
Do you have any tips for cutting through the noise? Because there are so many organizations that are really trying to educate Congress about their issue and their impact and their membership. So what kind of tips do you have for other execs listening to this podcast?
I just mentioned number 1, which is make it easily digestible. There's just way too much information out there nowadays. So we're hoping that this would be something they could refer back to if they need to. They can get information quickly. And then I think also seeing us as a resource for them. And if we don't have the answer, helping them to find someone who can give them the answer. So they see us as what I would say as an honest broker, helping them through the process as opposed to solely advocating on our specific issues and our specific position all the time. And then that way we become more of a partner. I used to work for someone who said, lobbyist is really not a bad word. Lobbyist is the same if you're doing it right as being an educator. And that's what I hope that we'll be at ABHW.
Oh, 100%. I totally agree. 5 months into the job, it's February 2025. What are the big goals for the association this year?
A couple of big goals in the policy area. I definitely want to see us being able to move something forward, whether it be on our own as private sector or possibly legislative or from a regulatory standpoint, but moving something forward that helps to advance this idea of coordinated care, measurement-based care, value-based care, something in that area. And then also we do have these priorities. I would say telehealth flexibilities is something that keeps getting punted down the road, and we want to make sure that that is still offered. Telehealth doesn't work for everything and everyone all the time. But one thing that, and I learned this in my previous role in the behavioral health space in particular, it does tend to be valuable. And some people actually can get better care and make better progress when they're receiving behavioral health services virtually because they feel more comfortable meeting with their provider virtually than in person. So again, everybody's not the same. It's not for everybody, but we need to make sure that it's one of the services that's available as appropriate when a provider thinks it will be especially valuable, or if a person has geographic restrictions or mobility issues, things like that. I want to see us being able to keep moving some of those things forward. And then the third area is just making sure that we as ABHW, the organization as a whole and our members are seen as thought leaders, and that we really are trying to drive the thought leadership forward in behavioral health. And the last thing is making sure that I'm being a good steward of our resources and growing revenue to the extent possible. So those are my 4 buckets for 2025.
So, top thing that you're doing to grow revenue?
Well, I'm doing 2 things, I would say. As I mentioned, we have 2 different tracks, primary tracks for revenue. One is membership, and the second is corporate partnership. So those organizations who provide services. So what I'm doing with our board, because they really know those kind of services better than I do at this point, is trying to understand who we can be good partners to in that area, and then reaching out to those organizations to join our corporate partner program. In the area of membership, that's a little bit trickier because, you think about ABHW, in the case of Blues plans, for example, we're probably their 3rd membership. They're probably a member of AHIP. They're probably a member of BCBSA. So I'm taking a look at the revenue structure and talking with the membership and trying to think about a way that we can engage with those organizations that will meet them at a place where they are with their budgets. So we're still figuring all of that out. I'm not trying to double the revenue in the next year, but want to make sure we're moving that forward. And then always continuing to provide value to the existing membership that we have so that we have that stability.
Debbie, what's the big vision that ABHW has? What's the world that you all imagine with regard to behavioral health?
I mean, the world that we envision is that people come into the healthcare delivery system. They don't have to navigate for themselves. They have care that's coordinated. They have services that are offered to them that is all seamless, and they can move in and out of the system, whether it be physical health, mental health, substance use disorder, whatever it might be, without having to figure all that out for themselves. And most people who have behavioral health challenges also have physical, either chronic disease or other physical ailments. And so it just doesn't make sense to be providing services individually. And that's where I think all of our members, I've heard this over and over, they want to see us moving to that kind of a system. Now, that might not happen in my lifetime, but we need to take the steps and create the building blocks to work toward that.
Well, that is a beautiful vision. I want to thank you for being on the podcast, for sharing everything that you did. And Debbie, you'll have to come back next year and tell us how you made progress on all of these things, because you've got a big year ahead of you.
I definitely do, Joanna, but I'm really looking forward to it. I feel very energized. I love the people that we're working with, and I feel like it's a great opportunity. So I hope that I can come back in a year and share some terrific successes. Fingers crossed.
It's a date. Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends. Bye!